Chapter 15.1, Psychological Disorders. Remember, these lectures are supplemental to your text. Psychopathology is the scientific study of the origins, symptoms, and development of psychological disorders. People with mental disorders are often depicted on TV as helpless victims or evil villains who were unpredictable, dangerous, and violent. One study indicated that overall, former mental patients did not have a higher rate of violence than a matched comparison group. People with severe mental disorders who are experiencing bizarre delusional ideas and hallucinated voices do have a slightly higher level of violent and illegal behavior than do quote-unquote normal people. There is very little risk of violence or harm to a stranger from casual contact with an individual who has a mental disorder. What is a psychological disorder? A psychological disorder or mental disorder is a pattern of behavioral and psychological symptoms that causes significant personal distress, impairs the ability to function in one or more important areas of daily life, or both. The DSM-5 is the abbreviation for the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which was published by the American Psychiatric Association about 6 years ago. It describes the specific symptoms and diagnostic guidelines for 250 or so psychological disorders. The DSM-5 provides mental health professionals with a common language for labeling mental disorders and comprehensive guidelines for diagnosing mental disorders. The DSM-5 represents the consensus of a wide range of mental health professionals and organizations. The prevalence of psychological disorders, is it a 50-50 chance? In 1994, two surprising findings were provided by the National Comorbidity Survey, or NCS. The prevalence of psychological disorders was much higher than previously thought. 48% of adults surveyed had experienced the symptoms of a psychological disorder at some point in their lifetime. 80% of those with the symptoms of a psychological disorder in the previous year had not sought any type of treatment. Two ways to view these findings. Many people who could benefit from mental health treatment do not seek it. Most people seem to weather the symptoms without becoming completely debilitated and without professional intervention. The NCS also found that the prevalence of certain mental disorders differed for men and women. Women had a higher prevalence of anxiety and depression. Men had a higher prevalence of substance abuse disorders and antisocial personality disorder. This ends Part 1 of Chapter 13.